So I just wanted to do a little update. I'm actually outside here on a terrace, which is pretty nice in like the rec area. Um, so it's been a rough couple of days. The study did not start on Thursday as planned. I was scheduled to have an MRI before everything started, and um, I had been feeling like palpitations all day in my heart. So when they put me on the table for the MRI, I was actually in a flutter or AFib, which is a really fast heart rate. So they weren't able to do the MRI, but they were also concerned as to why I was in that rhythm. So we had to kind of treat that first and get that under control, which was definitely not planned. But unfortunately, that's how it goes sometimes. So we were able to get that under control with medication Thursday night, and unfortunately, the physicians did not want to start the study on a Friday due to research labs and things like that. That it would be hard to send out on the weekends. So of course, I was not the happiest person, getting that news, but just another delay in what's already been delayed for a long time now. But hopefully things will start Monday, and we'll get back on track. So sure. Okay. So as of now, we're just watching. I was able to finally have the MRI of my heart yesterday, which showed a mass in my mediastinum, which is the space between my lungs, basically where my heart is. So that mass is more or less irritating the area around my heart. So I think we knew this mass was there. It's definitely bigger. So not great news. Some of the mass does look necrotic or dead on the scan. So treatment that I have been having looks like it was killing the tumor a little bit, but obviously it's important that we start this study and hopefully these T cells can attack that tumor. Again, not the greatest of 2 days here. Very frustrating news, but trying to see the bigger picture today and realize that got to be safe, and sometimes this is what happens when you're in a trial is you got to be patient because things need to be done a certain way to collect the data and the research, and I need to understand that. So going to be just hanging out on the weekend. Probably won't have much to update on. So hopefully come Monday, I'll be posting something when the chemo goes up, and that'll be good progress. So if all goes as planned, we start with a drug called fludarabine on Monday, which is a chemotherapy, part of the prep, and that'll mean we're starting and good to go. So in the meantime, if anything happens, let's just monitoring over the weekend. I'll try to post, but should be just a calm weekend and getting ready for Monday. So just a little update. Thanks, guys. Overwhelmed with the response from the first video that I posted. I didn't really think anybody would care to watch it, so thank you for following this journey, and look forward to keep posting. It gives me something to do, and I hope you guys are getting something out of it. And like I said, if anybody is thinking about needing to find a clinical trial for their treatment, or is hesitant about it, please share this with them, because I think there's a lot of misconceptions about it, and it can be a really good thing. So okay, we'll talk to you soon. Bye.